Magaling talaga ang mga Pilipino kahit sa ang field, lahat tayo nag-excel. Mapa-entertainment man, sports o beauty pageant, aasahan mo na kasama ang mga Pinoy sa listahan. And the good news is, pati medical service ay conquered na rin ng mga Pinoy. Ito ay ang the Axis Knee Replacement System, the only one of its kind in Southeast Asia. Our guest who is going to tell us more about this is currently the president of Orthopedic International Incorporated. He has a master's in biomedical engineering from the University of Minnesota. Among the patents he created includes external fixator with improved clamp and methods for use and the multi-axial bone screw mechanism. Diba? Parang introduction pa lang, kitang-kita mo na ang husay at galing ng ating guest for today. Mga ka-forever, let us all welcome Engineer Jude Sasing. Good morning, sir.
Good morning. Morning, sir.
Welcome sa DOSTv.
Thank you po.
Ayan, medyo interesting yung ating i-discuss ngayon di ba? Knee replacement. Ano ba talaga? Axis Knee Replacement System. Ano po ibig sabihin nito?
Ang Axis Knee Replacement System ay isang total knee replacement system na ginagamit for severe osteoarthritis of the knee. And ito ay project na dinevelop namin together with DOST. And ito ay available na ngayon. This was designed and manufactured in the Philippines. And the objective is for this to be available to more Filipino patients.
So Axis, ibig sabihin, merong iba't ibang types of knee replacement eh. This is a total, not partial.
Yes, meron ding partial knee replacement, but this is a total knee replacement. And there are many, total knee replacement has been around for more than 40 years. No? Unfortunately, in the Philippines, it's not as widely used. And isa nga ito sa gusto naming ma-inform ang mga patients na this is now available. And what is different with this Axis knee replacement system is that this was developed here in the Philippines and this is manufactured here in the Philippines. And the quality is just as good as any implant in the world. The materials are certified. Our factory is ISO certified also. So we can guarantee this is a very well-designed and well-manufactured implant. This is also approved by the FDA. And this is the first of its kind in the sense that this is the first public-private partnership in health research sa Philippines. No? And this is also the first one that we know that was designed and manufactured within Southeast Asia.
Okay. So ito talaga, gawang Pinoy?
Yes.
Gawang Pinoy talaga. Pero anong kinonsider ninyo kung bakit talaga naisipan o nabuo itong project na ito?
Yung aming company kasi is we were established more than 20 years ago by a orthopedic surgeon from Negros who went to the States and became very successful and decided to come back and give back his talents and his resources. So this is his name is Dr. Gustilo. And so right from the start, Orthopedic International was formed with the objective of helping more Filipino patients. And Dr. Gustilo, being an orthopedic surgeon and also one of the foremost knee replacement surgeons in the world, he actually designed several, at least 2 knee replacement systems. The Genesis 1 and Genesis 2, these were big products. And so he really wanted to design something, a knee replacement for Filipinos. So about 3 years ago, more than 3 years ago, Dr. Augusto decided to make a proposal to DOST to design and manufacture a knee replacement system for Filipinos and Asians.
So ano pagkakaiba natin compared sa ibang bansa? Halimbawa, kasi ito, ginawa ninyo para sa mga Pinoy di ba? So, ano lang ba to? Parang mas malapit ba yung mga, kumbaga mas, hindi na natin kailangan mag-angkat pa ng gantong klase ng knee replacement system?
Yes. Sa ngayon kasi, ang knee replacement is very expensive because they are imported from other countries. And one of the things that is different is that most knee systems now are made or designed in Western countries. So the dimensions are usually made for Caucasians. So we made this, we made the dimensions specifically for Asians. We have sizes that cater to Filipinos and Asians, but we also have sizes that cater to Caucasian needs. aside from that, see, knee replacement is a rather complex procedure, and there are, as shown earlier, there are different components. There are 3 components, and these components have to be aligned properly relative to the anatomy of the patient. And doing this until now has been more of a skill on the surgeon. It's just by estimate. In other countries, there are advanced devices that they use to align these properly, and these are called navigation systems. These are computerized systems that are very expensive, and they're also difficult to use actually. A well-aligned knee replacement can last for maybe 20 years.
20 years?
Yes.
Okay.
But if it is not well aligned, the implants are not well aligned, they will need revision within 3 to 5 years. So
bubuksan ulit yun?
Yes, then you have to replace the implants. So that's where alignment is very crucial. In our system, we were able to design instrumentation and surgical technique that will help surgeons to align the components properly without the expensive navigation systems they use in the States. And the implants have to be aligned relative to what's called the mechanical axis of the knee, and that's line from the center of the hip, center of the knee, and center of the ankle joint. And with our system, we can guide the surgeons so that the implants are properly aligned. And that's why we call this system the axis knee replacement system, because we have a system to find the correct mechanical axis and align the system, the implants along that axis.
So, sino katulong ng surgeon?
The surgeon is, usually we have a surgical assist.
Okay.
He's a nurse, but he's trained from our company. He goes assist the surgeon. But the surgeon has to be trained also to use our system.
So, with the help of other, kumbaga, consultants, do you have engineer with this project?
When we designed the project, this was a rather big project. We had around maybe 14 people involved.
Okay.
There was like 6 engineers. We have 3 orthopedic surgeons from the Philippines, Dr. Gustilo. We also had a surgeon from China, from Japan, and a couple of consultants from the States. So the project was really a collaboration between orthopedic surgeons and engineers.
Kasi before, kung wala pa tong ganitong klase ng device, ano usually, halimbawa ako pasyente, ano yung sagot kung sakaling meron akong ganong kaso?
Yes, osteoarthritis of the knee is a degenerative problem, meaning it comes with age. It's sort of age-related. In the early stages of osteoarthritis, this can be treated with medications, pain medications, anti-inflammatory drugs, therapy, weight loss. However, as the reason for this is that the cartilage is eventually, as we grow old, the cartilage degrades and it gets inflamed. That's why it's painful. Eventually, the cartilage becomes worn out. And when it gets completely worn out and you have bone-to-bone contact, that becomes very painful. And there is no more medication that can be used. And the only option at that stage is really total knee replacement. So what is done is the cartilage is removed, and then metal and plastic components are inserted or placed over the bones so that there's no more contact between bone and becomes painless, no? And you return mobility to the patient. So
what's the plastic are you using for this?
The plastic is made of ultra-high molecular weight polyethylene.
Ayun.
It's
So
medical
very
grade.
safe.
Yes. And the metal is called cobalt chromium. It's also a biocompatible material. It's been used for quite a while.
So metal yun, sir, hindi yung kakalawangan sa loob.
Oo, hindi siya kakalawangan.
Oo, di ba? Siyempre, ipapasok sa loob ng katawan mo yun. No? So, ito, tatagal for 20 years, sabi nyo nga kanina.
Yes.
O yun. So, paano nyo na-consider ito na parang ito yung breakthrough in the medical field?
Well, it's a breakthrough because actually there are 4 patents pending on this system in the States and in other countries, and also, of course, in the Philippines. It's a breakthrough because, as I mentioned before, alignment of the components is very crucial to us to success, clinical success. And until now, this is done, as I said, by eyeballing or by expensive equipment. And with our system, we are able to do this with a simple, relatively simple mechanical device, and it aligns the components properly. And so far, our surgeons are very satisfied with the results. So we think that this is a breakthrough in that sense.
So pagka naka-clamp na siya, ang lakad ba ng pasyente parang normal lang? Parang hindi mo maiisip na meron akong bakal sa loob ng katawan ko?
Patients have said that eventually, yes, they forget that they have ever had total knee replacement. Yes. You mentioned ko lang din pala na it's also a breakthrough, at least in the Philippines, no? In the sense na this is very affordable.
Very affordable.
Yes, compared to existing systems. Existing systems in the market probably would be about 120,000 pesos, yung knee replacement, yung implants. This system is available in the market for 70,000 in private hospitals. However, for government hospitals, because it's a joint project with the government, this is available for only 60,000. So there's a big
Magkano?
jump.
60 na lang, sir?
60,000, yes.
60,000 na lang. Oo, sa bagay, no? Tapos, compared noon, kung talagang magpapa-import ka pa from ibang bansa, di mas mahal.
It's almost double the price.
Sobra. Oo nga, parang around 400,000 in peso. Ito, ang DOST talaga, napakalaki ng tulong when it comes to this project.
Yes. Tumulong ang DOST in terms of funds. No, they gave us funds. It was co-funded by our company and DOST through PCHRD, no, Philippine Council for Health Research and Development, and DOST has also helped in an information campaign. In the Philippines, let me just put it in context. In the US, they do about 700,000 knee replacements every year. In the Philippines, we do maybe 2,000-3,000 at most. If we look at the demographics, we look at the number of possible patients, we estimate that there should be about 70,000 knee replacements done in the Philippines. There are three reasons we believe why this is so. There's a big disparity. One is, of course, the cost.
Yes, definitely.
And that's why we were able to bring this down, and we hope that it will, solve that particular reason. The second reason is the availability in terms of surgeons. There are only about 60 orthopedic surgeons trained specifically to do knee replacement. The reason for this is that after finishing orthopedic residency, a surgeon has to undergo another year of training just to do knee replacement and joint replacement in general. The reason for this is the alignment, again, as I said, is very crucial, and you have to learn how to align the implants properly. With the system that we have, the Access Knee system, together with our instrumentation and our surgical technique, the surgeon, an orthopedic surgeon who no longer has to undergo a 1-year training fellowship. He can do the procedure with just a few days of training with our company, with Dr. Gustilo. And so the idea is we want to make this available in the provinces, for example. No? So instead of 60, we're now talking of potentially there are 600 orthopedic surgeons in the Philippines. So this becomes more accessible. So the third reason is there's cost, accessibility in terms of number of surgeons. The last reason is information. We think that many of our patients in the Philippines are not aware that there's knee replacements available in the country, and that it is now even more affordable. And that's why we're doing this information campaign, and we're very grateful for DOST, STII for helping us with this effort.
Is this technology globally competitive?
Yes, it is globally competitive. As we mentioned earlier, this was designed for Filipino anatomy, but as I also mentioned, there are also sizes that cater to Caucasians. What makes it especially competitive is the instrumentation and surgical technique. Because this technique and the instrumentation is universal. And this is the same problem that they have in the States. Alignment is still a problem. Technique is a problem.
Okay, so when it terms to dun sa mga patient katulad ng ganyan, no, talagang nasisiguro natin na magiging mas magaan na yung kanilang pakiramdam once na nakasuot na sila nitong clamp na to, itong knee axis replacement system.
Yes. Patients can return to normal daily activities. No? So before, when they cannot stand or becomes very painful, they can return to normal lifestyle. They can walk, they can bike, they can swim, they can even do ballroom dancing.
So meron kasing benefits, di ba? So ano naman yung risk factor?
Well, first, I'm not a surgeon.
Okay.
So, but from what I know, knee replacement is one of the most successful procedures known, no? Because the success rate is very high, and the risks are, compared to the benefits, the risks are very manageable, quite small. It's still a general anesthesia procedure,
Yes.
but complications are very low, and patients become very satisfied with the outcomes after the surgery. Is about maybe 1 to 2 hours, and normally this is done in the morning. In the afternoon, the patient can walk, can stand up, can walk around the room. Normally he can, particularly with our system, they can leave the hospital maybe the following day or 2 days after.
Bilis lang pala. So 1 to 3 hours, ang
Two
operation,
hours
1 to 2
siguro.
hours
1 to 2
lang.
hours, yes.
Okay, tapos may pahinga ka lang, pwede ka na umuwi, no? Parang tumambay ka lang sa ospital.
This is even done outpatient in the
Okay,
States.
okay. So as of the moment, gaano na karami yung pasyente na nakikinabang nito?
As of now, there are about maybe 80 knees that we have implanted. Yes.
Since nagsimula itong
Yes.
project na ito. Okay. Any more long-term goal siguro for this project? From time to time ba, kailangan na-develop pa rin natin ito?
Yes, long-term, we are planning to sell, to export this, no? And we're planning to initially sell this within Southeast Asia. We're also developing other sort of accessories or components within the system. For example, we're looking at revision systems, no? Revision knee implants. This is more complicated than the primary. This is called a primary system.
Ayun. And aside from this knee replacement system, ano pa yung mga nakalayap sa inyo na project from your office?
Yes, we have currently we have a spine system, we have a hip system, we have implants for bone fractures, and we're continuously creating new designs. And as I mentioned, we're looking at a revision system. Revision knee system is also a difficult procedure, and we hope that with our breakthrough, our patent pending instrumentation, we can make this more consistent and easier for the surgeon.
Kasi di ba, halimbawa, dito sa Pilipinas, gaano kalaki yung kumbaga yung rate when it comes to orthopedic sa inyong office niyo, mga kaso ng mga Pinoy na nagsasuffer sa ganito mga klase ng
Yes,
sakit?
siguro, as I mentioned, there are about maybe 70,000 Filipinos today suffering from knee replacement, from osteoarthritis.
Yes.
And there are about 70,000 every year that can be, whose knees can be replaced with total knee replacement. And it's a painful disease, I guess.
Yes, totoo. Tsaka napakaselan, hindi ba, sir? Any more upcoming siguro mga halimbawa when terms to sa mga Asia, nakakasabay na rin tayo, hindi ba? So, ito ba pang worldwide na rin? Let's say nasa ibang bansa ako, pwede na ba akong kumuha sa Philippines?
Sa ngayon, we are not yet exporting. As I mentioned earlier, we're planning to export to ASEAN countries. However, we're also the Department of the DTI, Trade and Industry,
Yes.
is also sort of selling the idea for this project for medical tourism.
Okay.
So this is not available yet in other countries, but they can come to the Philippines and have their knees done. It's more affordable than doing it in their home countries, and we have a very nice, well-aligned system that's made here in the Philippines.
Ayun. Any more messages na sa ating mga taga-subaybay? Baka meron tayong mga nanonood sa atin nangangailangan na pala ng ganitong
Yes.
system.
Yes, I would like to let our mga kababayan to know na yung knee replacement is available now in the Philippines, and this is made more affordable through this project, the Access Knee Replacement System, which is a joint project between the government and our company. And you can contact your orthopedic surgeon. You can go to our company website to ask more information about this. Our company website is www.oii.com. I would also like to maybe mention to maybe the government that this is a we're very grateful for this project, and for the support from the government. And the other thing is, since this is a government project, it would be very logical, I think, and very good, very helpful for our indigent patients if this can be, the procedure can be done in government hospitals more often. Maybe if there's right now kasi implants are not covered by PhilHealth. The procedure is covered, but implants are not covered. So the patient still has to shell out some money. We have done our part in a way that we've made this more affordable now for government patients. So I hope that there's more. We're trying to work with the government on this.
Thank you so much. Ayan, sir, marami sana marami makinabang dito, lalo na't matulungan lalo na yung mga hindi talaga kaya naman makapaglabas ng pera, di ba? Yes. Thank you so much. More power sa inyong project. Ayan, mga kaibigan, mga ka-forever, di ba talaga naman sa bawat larangan nakikilala ang mga Pinoy at nakaka-proud na yan ay mga gawang Pinoy. Nakakataba ng puso to learn that we have what it takes to excel and touch people's lives.